Yeah, so as far as my expectations for this in-office training session go, is I really want to develop confidence in being able to treat my patients predictably and in a systematic way that I would then be able to really help them with their conditions. Before Ben came out, I would see the numbers on the scanner and on the T-Scan, and I wouldn't be able to really kind of figure out exactly what adjustments need to be made to improve our patient's condition.
I was fortunate enough to have Dr. Sutter come to my office today, and he went to my friend's office, Dr. Lily Chan, yesterday in Houston. So I drove up there because I wanted to maximize as much of the knowledge as I possibly could gain, because every patient experience is different, every bite is different, every person is different, and every situation is different. So really, in the last 2 days, I was blessed enough to see about 8 patients. We saw patients with trigeminal neuralgia. We saw patients with full mouth reconstruction. I had the opportunity to do the T-scan on myself, and I feel very different. We had an opportunity to do it on my own team member that had one tooth that was bothering her. So we really looked at various different types of people. And to answer your question, have we met my expectations? I would say above and beyond. There's no way I could have implemented this training had I just bought the T-Scan and done the online training and watched YouTube videos. Having the practical, hands-on knowledge with somebody that understands occlusion so wonderfully it's life-changing. It really changes the way I'm going to practice.
The value was that we could now really understand and internalize the data, whereas before we didn't quite speak that language. We didn't quite understand exactly what the difference between overall data was and the actual timing. And from that standpoint, we were able to actually see patients, our own patients that I've been struggling with as far as breaking crowns, as far as breaking teeth, as far as joint pain, muscle pain. We're actually able to see that in real time with patients that I've treated for years and not really had any answers. And for me to be able to give those answers to our patients really just, it means the world to us, and it really is life-changing for them.
You guys both have an interesting story as clinicians in the sense that you've taken a lot of CE and you've taken a lot of occlusal CE and reconstructive CE, and still, did you find missing links today? Were you able to correlate a lot of things that were maybe black holes in your understanding as far as occlusion is?
Yes, and I liked how you said that, the black holes. And I feel like every course you take, it's not a one-size-fits-all. You're going to get all the answers with one training. But I do feel the most important thing in dentistry that we're not possibly taught as well, or it's not understood as well, or perhaps I didn't understand it as well, is the most important thing is how teeth come together, is occlusion, is understanding bite relationship. And traditionally in dental school we look at the articulating paper. I mean, I look at things, I adjust things based on the articulating paper. Now I understand that is 13% accurate, and I saw that on the T-scan because we had a lot of false positive, sometimes false negatives.
I mean, it's night and day, huge difference. So I've had T-scan for about 2 months, and I've done the 2 hours training that they offer, and I had a basic understanding of it, but I didn't really feel comfortable touching the patient or adjusting anything, based on the 2 hours. And now today, even after my first patient with you, I was so comfortable. By the time I was with my second patient, I was showing you, okay, I'm gonna do this, so
Right.
It's a huge difference, huge confidence. My confidence level now, it's amazing.
As a high throughput dental practice owner, what are your thoughts about practicing without it?
It's like being blind. You don't know what you don't know. So it just opens up a lot of information that you didn't know before. Like one of our patients today had actually heard a crack in his tooth, and sure enough, he was hitting hard on there, but we knew exactly where to adjust, and it just peace of mind that you're adjusting the right, and to see the scan before you adjust and then the scan after the adjustment, and then the patient going like, oh wow, it's a whole new bite. And we adjusted my assistant too, and she's like, I don't have any issues, I don't have any issues. And then she's hitting hard, was it 40% on one tooth on 15, and I adjusted, and all of a sudden she's like, it's a whole new mouth. Oh my gosh, oh my gosh. So I'm excited.
Well, I'm excited for you. And would you recommend the training to other T-Scan owners?
Definitely recommend the training. You are doing yourself a disservice by not booking your training. You just want to have the confidence that you're implementing correctly, and you're reading the data like you need to read the data, and implementing it, and then following up with your patients. So book it.
I think that the impact, I've been using T-Scan for a little while, for about 5 years, but I never took it to the depth, and I didn't recognize the depth that it could go to. It reestablished a sense of hunger for me to say, I should not be doing cases without it. And when I'm quick to see you working on patients and seeing how quickly you're making an adjustment, you're bringing it out, you're using it, you're going back and forth. It is very natural flow. It's not, oh, we need to stop and get the tech scan out and do this and that. It's a very natural flow. It means I need to take my hunger for it, take it deeper, and realize how much more I can do with it. And I feel that a lot of practitioners are just scared to add another technology. This is basics. This is not another technology. This isn't going out and buying the next, everybody's so excited about buying the next 3D milling, 3D printers, all these other things. And those are adjuncts to your work that will likely fail if you're not doing this.
That's true.
And I struggle with that. I struggle with that thinking about my own patients. I struggle with that thinking about the doctors that I work with. I struggle with that for my patients. I believe that they deserve better. And if you think that you deserve better, if you believe your patients deserve quality standard of care, and you're not doing this, then you're just starting the domino effect in their mouth.
Hi everyone, my name is Daniela Eversgerd. I'm a general dentist in Mandeville, Louisiana, and I am a new T-Scan user. I have been a user for a couple months now, but was kind of shy to use it at first. And about 2 weeks ago, Ben came into my office and did a training for my entire team and I. And he was in on a Friday. On Monday, the very next Monday, we already started implementing it in hygiene and our new patient exams. And that first week, we already had 3 patients booked for occlusal optimization. And so I feel like it's already paying for itself. The course was amazing, super informative, and in my opinion, it's the right way to implement T-Scan.